Welcome, and thank you for participating in the 2020 Virtual PSW Educational Conference offering. We are grateful for everyone's support and efforts to adapt this year's conference into a digital format that will be shared with pharmacists, pharmacy technicians, and student pharmacists across Wisconsin. To record your attendance for this presentation, you must watch the recording and enter the CE code given during the presentation. All videos will be available in the continuing education platform. After watching the videos, you will enter the CE code provided to you during the session in order to record attendance and claim your CE. You may choose as many sessions as you are interested in. In order to get back into the virtual conference, please make sure to save the original sign-up email from the Lecture Panda system. This link is the only way to get back into the course. You do not need to complete everything at once, and your progress will be saved until the next time you log in. CE will be reported directly into the CPE Monitor portal. PSW recommends that all pharmacists and technicians should regularly review their CPE Monitor portal for accuracy. If you cannot find your original email, please email info@pswi.org to have your individualized link sent to you.
Welcome. This is the Just for Tech session, navigating challenging situations for technicians, fostering positive working relationships. This was intended to be an interactive session, so we're hoping that there'll be points in the session where you can pause the virtual learning and think about the situation that we've discussed or the skills or the tasks that we're hopefully going to share with you today. So feel free to use that pause button and play the presentation again when you have had an opportunity to think about that in an attempt to be a little bit interactive. So the learning objectives for today include using strategies to improve tech-to-tech and tech-to-pharmacist, as well as tech-to-provider and tech-to-patient interactions, which I'm sure all of us have experienced at some point in time. And we think we have some really good examples to help us work through improving some of those pretty common interactions that we see. Being able to utilize situational awareness strategies, sometimes called emotional intelligence, and then hopefully to outline some strategies available that will help you navigate some of the challenging situations that you see or are part of in your everyday workplace. So today's format, we're going to do some introductions, and then John and I, after we introduce ourselves, are going to look back on some difficult situations that we've experienced. John and I will give you some pearls, and then really the best part, I think, of this presentation will be the breakout scenarios towards the end of the experience. Which will allow you to hopefully try on for size a few of the things that John and I are going to share. I'm so sorry, it's super touchy. So I will let John introduce himself.
Thanks, Sarah. My name is John Muchka. I'm a clinical pharmacist at Frederick Menominee Falls Hospital in Menominee Falls. I'm also the PGY1 residency coordinator there at that hospital. I'm very happy to be here talking to you guys about crucial conversations and situational awareness. And I'm very, very happy and humble and proud to be presenting with Sarah Pagenkopf, who presented on a similar topic in the PSW Leadership, Emerging Leadership Certificate Program last year. So she's got a lot of great stuff to talk about today, and I'll kick it back to her so she can introduce herself.
Well, thank you, John. You're so graciously thoughtful. I appreciate it. I'm blushing. You guys can't see that, but if we were together, you would be able to see that. I'm the director of pharmacy at Fort Healthcare in Fort Atkinson, Wisconsin, and I'm the residency program director as well for our Little One resident program. But as John mentioned, we are very excited to share with you some great ideas and strategies we hope that you'll be able to apply to things that are going on in your everyday work life. John and I do not have any financial disclosures to share, but we would like to share with you some difficult situations that we have experienced in our work days.
Absolutely. So I'll start off with my difficult situation. This happened pretty early in my career as a clinical pharmacist, and the outcome wasn't the best. And a lot of stuff that we're going to be talking about today, if I would have known or would have utilized some of those tips, I think the outcome probably would have been a lot better. So after my residency, I was staffing at a hospital as the central pharmacist. And that wasn't my normal role. I was usually decentral on the floor. So I wasn't 100% familiar with the workflows that happened in central pharmacy. I was pretty proud of myself. I thought I was doing a really good job down there, and we were keeping up. I mean, we weren't getting a lot of phone calls for missing doses. I thought the nursing staff was pretty happy with our performance as a department in central. But there was a technician that I was working with who you could just tell was visibly upset, lots of eye rolling, lots of scoffing, and finally I just said, "What is going on? What's the problem? What's the problem?" And then this particular technician just unloaded on me with a lot of the things that I wasn't doing that the normal central pharmacist was doing, and I didn't realize that I wasn't performing all the tasks that I was supposed to. So you guys will see some tips and tricks later on in this presentation that I wish I would have used, and I think the outcome would have been a lot better because the rest of the shift and the weeks to follow weren't very comfortable when I was working with that technician. So that difficult situation was the thing that actually motivated me to learn about crucial conversations and situational awareness. So I think now I have a better handle on it, and the conversations I have now have better outcomes. So don't do what I did the first time around. Listen to some of the stuff that Sarah and I are going to try to teach you today, and I think you'll fare better than I did.
And I would just reiterate, I think that I was looking for a really good difficult situation to share. John's situation is a really good example of how when we're doing something we really don't normally do, or maybe he was working that shift because the day was short, someone called in sick. That was the example I was going to share this morning, someone calling in sick, and that disrupts the day for everybody else. You kind of shift around the chess pieces, and nobody's really happy, but they're okay with it. And it's those situations when you feel out of your comfort zone, or you're doing something you haven't done before, or you're managing a situation acutely, very quickly because you want it to work well, and not everybody is always happy. Or like John said, you pick up on some of those nonverbals. And so you want to ask, what's going on? Why are you doing that? Why are you making me feel that way? And why am I feeling this way? And like John said, I think that we're hoping that we'll be able to share some of those strategies and ideas that can help you not only to recognize that you might be in a situation where that situational awareness comes into play, and then also how to manage that through a crucial conversation. So let's begin. So I was going to open by saying, John and I shared two situations, but how many times in a day do you look at your coworker or your spouse or significant other, or even your children, or maybe your boss or your leader, and think to yourself, really? Whether the request is totally outlandish, or the request makes you angry, or the request even makes you feel fearful. You want me to do what? You want me to do something that I haven't done before? So it's those situations generally where you're so scared or mad or anxious or frustrated that you might have a tendency to avoid. So if we were together, I'd ask you to raise your hand and show me how many of you might have avoided a conversation in the past month where you were scared or anxious or mad. When working with one another, there are lots of skills and tasks that we just know how to do. We learn or we train, we follow a standard operating procedure, we go down the checklist, and we can do those tasks. It's the other stuff that comes in between that generally is the stuff that can either give us a really good day or a really bad day. How many of you potentially have worked with someone who was having clearly a bad day? They came in, they looked unhappy. There might have been some eye rolling or some sighing or some louder scuffling of papers. And suddenly everyone in the department or the area or the work group is feeling that anger or that frustration. And on the opposite end of the spectrum, how many of you come in to have a really upbeat pharmacist or a really upbeat coworker or tech who is able to help you and manage the day much better because everyone is looking forward to the day? So I think that either one of those can play into it. But really, this is my favorite equation that I like to think about, and this is really what helps me to stop and think before I say, very similar to John, what's your deal? What's your problem? What's going on? It's an area where there's a potential for disagreement or conflict. Emotions are high. I'm anxious, I'm scared, I'm angry. And usually we will make two choices. We will avoid that situation, or we will continue down that pathway, or we'll hold it for so long that it bothers us more and we move to a place of anger. And we don't want that. What we found was that, sorry, it's so touchy, is that one way we can communicate better is looking at how we feel before we communicate. So I'm going to take a little time and quickly back up. It depends on who you ask, but there are a few different gentlemen who believe that they were the first to coin the phrase emotional intelligence. But really, the best history I have on this is that Harvard Business School was looking at what made Fortune 500 companies successful. And they looked at onboarding, and they looked at interviewing skills, and they looked at the company's branding, and they looked at the company's networking, and how did they have mentors and mentees, and how did they even followed those people and found out and looked at their their intelligence quotients or their IQ. And what they found was that the smartest people weren't always the most successful people. The people that interviewed really well or onboarded really well or branded their product really well weren't always the most successful companies. They realized that those companies had something else. They had something in their mix, and they began to investigate what that something was. And many times they found that it was an employee saying that their boss was amazing and caring, or it was an employee to another employee saying, I really love the people I work with, or the culture I work in, culture in quotation. So they coined the phrase, the phrase was coined that it was emotional intelligence, or really feeling, or being part of, we use the word situational awareness. Of knowing what the situation that you're in and how you're feeling so that you can act accordingly. And they broke it down into these 5 different areas, and some of them are slightly different depending on whose book you read. I've read quite a few of the books, and so these are the ones that I'll admit I like the best, but you can make your own determination. And those 5 areas include self-awareness, self-regulation, decision-making, empathy, and stress management. And so I'm going to spend just a brief amount of time as we quickly move through to look at each one. So self-awareness is really that reflecting. So when you're in the moment, how are you feeling? And why do you feel that way? This one takes into account your past. So if you had a really amazing relationship with your tech crew before and you start a new job, you're expecting that amazing relationship with the new team. And that may or may not be the case. So that one takes into account your past and your past relationships. It's also how your emotions impact others. So if you come in looking grumbly, will that impact others? And will they be grumbly too? It's also recognizing your personal strengths and weaknesses and trying to improve upon those. So that's really self-awareness, something that we teach to a lot of of our residents and our student learners to say, where are you at? And how does that resonate? What is your awareness of your situation? Self-expression is really the verbals, the nonverbals too. So that's the eye rolling. That's how you dress. That's how you present yourself. That's how you face the world, both in your face and not in your face. But that also can be your assertiveness or your non-assertiveness. That can be your independence. And do you just do it yourself, or do you usually create a team and you do it together? And those aren't good or bad, but that's just how you express yourself. Interpersonal or empathy is the third one, and this is really one that's related to your relationship building, being able to walk in someone else's shoes. This is one that I find myself frequently when I'm having crucial conversations saying, what were they thinking and why are they thinking it that way? And that's the one that usually helps me to say, I see where this intentions didn't match my actions. What I intended was not what was received by the person who is upset with me or that we're having a crucial conversation with. Decision making is using your emotions to solve that problem and make the best choice, and that's controlling your temper. But that's also reality testing. I'm sure each one of us has had a situation where you have that negative self-talk, right? So you come in, you say, oh, there was a sick call today. I got the text on my way into work. It's going to be a horrible, miserable day. It's going to just be horrible. And before you even get to work, you've already set yourself up to fail because you beat yourself up with that reality testing. And is that really the real situation? So being careful of self-talk. And the last one is stress management. So being flexible, tolerating stress, controlling your impulses and your optimism, which is your ability to be positive. I will say, with everything that's going on with COVID-19 right now, stress management is probably the biggest one that all of us need to keep watching, and not letting ourselves get carried away with those negative thoughts or the stress that's going on in our life. So, I'm sorry, John. I found a really great article, and it talks about using these 6 techniques when you're working with someone. So I'm going to quickly just share that the do-don't technique is saying, I do need to talk to you about something. It's difficult because we're friends or we're colleagues, but I don't want to make you feel this way. Someone once told me that your intentions, you're judged by your actions, not by your intentions. So one of the ways that we can manage that better is by saying what our intentions are right away. So the do-don't or don't-do is one of the ways that we can manage that. Just sharing with people, telling them right out that you care about them. I care about you. We care about this together. We care about our patients. We care about our job. We care about our children. We care about getting stuff done, whatever that is. So finding that common ground. Being clear about your behaviors and saying, I saw what happened. I saw you do this. I came in after work and the cart fill wasn't ready. I went back to the register and you didn't balance the till for the afternoon. So not going into things that how you feel, but stating just the facts about those behaviors. And then stating the effects. When you do this or when you don't do that, it puts our patients at risk. So all of these are talking about the emotions that you're having, but you're putting them into a factual statement rather than saying, you make me so mad, or that's really, really immature of you not to do that thing. Whereas it makes more sense to say, I feel that you may feel that they were being immature about something, but saying when you don't balance the till each night, we have the potential of having a loss, or when you don't fill the automated dispensing cabinet correctly, we have a real risk of having a patient safety issue. So stating the effects. And then asking for what you need. I would really like for us to move through this and continue to be great colleagues, but to do that, we might need to X, Y, or Z. And then reconfirming and saying, I came to you and I hope that you understand that I did this directly because you are important. Hopefully you're not doing it in front of the rest of the team, But bringing it back to say the reason I was brave enough to come and talk to you about this is that you are important to me and I want our relationship to continue. So I know that John is going to move next, if I can get this to go to the right slide.
Perfect. Thanks, Sarah. Sarah did a great job on pointing out some of the things with situational awareness and how you feel during certain situations and how your actions might make others feel. I'm going to talk a little bit about having that crucial conversation when you want to speak up and you want to have a conversation with someone to resolve an issue, and give you some pointers on how to do that to have a good outcome. And just as important, I'm going to point out some common pitfalls that I know I've run into along the way. We'll identify those and we'll try to help you guys avoid those and not make the same mistakes that I made. So communication is key. George Bernard Shaw has a quote that I think is excellent. It says, "The single biggest problem in communication is the illusion that it has taken place." You can take out illusion and put assumption in there as well. I don't know. I would say raise your hand if this has ever happened, but I'll give you an example. In my personal life, my wife says pretty regularly, "John, we talked about this," and I'm quite confident that we didn't. It was an assumption that this conversation was had, but maybe it wasn't had, or maybe it was and I just wasn't listening. That's probably more an accurate reflection of what actually happened. But we make assumptions every day about other people and what they know, and we assume that they know what we know. But in reality, we might be trained differently on certain things or have different ideas how to complete different things. So it's very important to actually have that communication, have that conversation, not assume that everybody knows the right way to do it or the way that you do it. So when we have these challenging situations, they can pretty much end three ways. The first and probably most common is they don't happen at all because we avoid them. The majority of people don't like conflict and will do anything to avoid conflict. There are a few people out there that don't mind conflict and it doesn't make them uncomfortable to have those conversations, but the vast majority of people, including myself, would rather avoid it. Let's just not say anything and maybe it'll go away. Newsflash, they usually don't go away. So we should have these conversations, and I know it's very uncomfortable, but going forward, it'll probably be a better work environment if you do have those conversations. The next way we can handle them is handle them poorly. This happens more often than not. So why do they end poorly? Well, unfortunately, we have about 10,000 years of evolution stacked against us. So our ancestors way back when had the fight or flight response, which we continue to have today. In their circumstances, they might have encountered a saber-toothed tiger on the walking path and they needed to run away or fight. Our bodies react in the same way when we're in these high tense, high leverage situations. And unfortunately, all the blood is going to be rerouted to our extremities. Epinephrine is released, adrenaline is released, and we're not thinking clearly. We have lots of thoughts that are racing through our minds. The only organ that we're probably using in the situation to make decisions, our brain, isn't getting perfused as much as our other organs. You might be, quote unquote, seeing red in these situations, and we're not thinking appropriately, and we don't have the best mindset to have those conversations. Lastly, we could handle them well. Well, how do we do that? Well, that's what this presentation is all about. We're going to try to give you guys a few tips and tricks to improve the outcomes of these situations. So what are the main ways that these challenging situations or conversations go wrong? There's two main ways, silence and violence. So silence would be anything to avoid having this conversation. You're just going to withdraw yourself completely. You're going to avoid the person that you need to have this conversation with. Or masking. Oh, nothing's wrong. Everything's fine. Everything's fine. The other way they get wrong is violence. And this isn't physical violence, but violence defined as any aggressive action taken in order to make your point. So controlling or coercing the person you're having this conversation with. So I know it's difficult to have these conversations with someone who might be your one-up, your leader or your director or so on. And sometimes those people, if they're not handling the situation well, might use their position or their status to influence how this conversation's going. When you are having these conversations and someone enters it with an aggressive nature, you're immediately put on the defensive, and nothing good is going to happen from those conversations. So if someone comes in and they start attacking or belittling you right away, you're going to stop listening immediately, and that conversation is over. So when we have these conversations and we want a better outcome, here are a few tips for handling the difficult conversation. So first, and I would say the most important, is make it a safe environment. If you guys remember my difficult situation that I presented earlier on in the lecture, I didn't make it safe. The first thing listed under here is a private setting. That's something that I did not do. I asked what the issue was in front of coworkers, and that definitely was not the right thing to do. If you approach people in a public setting around their leaders or their other coworkers, they're going to get defensive right away, and you're not going to have a fruitful conversation. So what I should have done and what I do now is, if I'm going to have a crucial conversation, I'll pull this individual aside, a private setting, make it safe so they're not embarrassed, so they're not defensive right away. You have to display mutual respect. You have to come from a place of caring, and you want this situation to be resolved, and you want your workplace to be better for it. So you need to go in with that mutual respect. Sarah had mentioned this earlier. You need a common purpose. And in pharmacy, it's pretty clear if you're taking this from a professional level. Patient care is our common purpose. We want to provide the best patient care, whether it's in a hospital setting, in a retail setting, long-term care facility, anywhere where pharmacy is there. Our job is to take care of the patient, get them the right drug, the right dose at the right time. We need to learn to look. And what I mean by this is we need to watch the verbal and nonverbal feedback from the person that we're having this conversation with. So throughout the conversation, you might notice that this person might start rolling their eyes or flailing their limbs or getting visibly upset. You need to look for those cues. And if you feel like this conversation is getting out of control, there's nothing wrong with taking a step back and saying, listen, I understand, I can tell you're upset with what we're talking about. I know that emotions are high. I don't want to say something that I don't mean, so I'm going to withdraw from this conversation, but I would like to revisit it at a different time. There's nothing wrong with that. And having done that in the past, people are very willing to re-engage with that conversation when the emotions aren't as high, and you'll have a positive outcome. Use facts when telling your story. I know Sarah alluded to this on her portion of the presentation as well. Don't use hearsay. Don't say, well, everybody says you do this, or everybody knows that you don't do this right. You need to use facts when having this conversation, because people won't respond well to hearsay or accusations, but they will respond to facts. Avoid the blame game. This is something that I see and I find myself doing a lot of the time. So there's three categories that we can fall into with the blame game. So you can be the villain. Well, it's your fault that this didn't end correctly because you did this or you didn't do this. You can also be the victim. Well, it's not my fault. I did my job right. I'm not sure what happened. Or you could play the helpless card. And I see the last two bullet points being played together quite a bit. So the helpless is, well, there's nothing else I can do. 99% of the time, that's not true. There's always something more you can do. You can have a conversation with someone who you don't think is performing at the top of their level or what you think they should be doing, and have that conversation. But you see those two, well, it's not my fault. There's nothing else I can do. Know that that's not true, and there is more you can do. And if you go out and you extend that olive branch and you're having that conversation, I think you'll be surprised at how receptive people will be. Make your expectations known. So this goes back to the conversation that I had with that technician. if she would have told me what the expectations were of me to do, I think we probably could have avoided that blow up in the middle of central pharmacy that was not only embarrassing for both of us, but it wasn't very professional. So if somebody's not doing something that meet your expectations, you need to let them know that. More times than not, it's not intentional. They just don't know that that's what they're supposed to be doing. You need to be transparent with them too. And using some of these tips going forward and what Sarah said about situational awareness and emotional intelligence, you're going to be able to improve these crucial conversations that you have and feel a little bit more confident entering these crucial conversations. I know the residents have developed a few cases, scenarios revolving around crucial conversations. So the second part of this, you're going to be going through those, pause and reflect on how you think you would handle the situation after the scenario is presented, and then hear how the resident would do it.
As John mentioned, the second part of our presentation today will really be focusing on putting these skills that we've now talked about, putting them into action, into use, reflecting on some potential scenarios that some of you may have already encountered in your daily practice, just making sure that you're well equipped for the future. These scenarios were put together by pharmacy administrative residents from across the state, and they will be leading these scenarios today. I'm one of those residents, and my name is Connor Hansen.
And my name is Ryan Simonette. So for this activity, one resident's going to read you the scenario. I would encourage you then to pause the video and think back to what John and Sarah discussed. Reflect on your self-awareness. How would you feel in this scenario? Think about what you might do. Are you able to put yourself in the other person's shoes? And are you ready to and able to have that discussion with the other person about the situation? When you're ready, unpause the video and another resident will explain how they handled the situation or how they would handle the situation if they came across it in the future. Here are the names and contact information of the residents that put these scenarios together in case you have additional questions about the scenarios or about health system pharmacy administration. And with that, I'll pass the mic to Kevin and Kelsey to get us started with our first scenario.
So our first scenario is a coworker working with minimal effort. It's a busy day in your pharmacy, and you notice a technician coworker who seems to be putting minimal effort to complete the day's task. As a result, you're having to complete extra work on top of your normal responsibilities, and you notice your own performance faltering. Soon, you realize that you are making simple mistakes you don't normally make due to the increased workload. The other technician seems relaxed, laughing and joking with the other teammates, and is not exerting much energy to help with the current workload. You need to talk to your coworker about his efforts. So Kevin, what are your thoughts? How would you handle this scenario?
You know, I think a lot of us can relate to this situation, and I feel like a lot of us have been in this situation in the past. I know I've found myself in this situation, and the way I really handle this is before you make any sort of contact or communication, is to do that self-reflection piece, similar to what John and Sarah talked to us about. Make sure you understand how you're feeling. If you need to step away and collect your thoughts, I think that is appropriate to do at this time. So really making sure you have a self-awareness, you know what you're going to say, you have everything lined up, and your emotions are under control when you go into this. But when I go into this situation, the first thing that I would do is I would start by stating something like this. I need to talk to you about something important. It's difficult because we are friends. I don't want to make you upset, but because I do care about you, and this is something that I want to talk to you about. And I think when you say that, it's really important to make sure you guys are in a private environment, a private situation. It's the point where there's not other coworkers around getting involved within this situation, and that point where they can hear what's going on. This is something that needs to be done in private, like John and Sarah had mentioned. Go on to say, you know, we both care about the health of our patients. We both care about the team that we're working in, and I think that's something that you really need to do, is relate with each other. Be clear about the behaviors. So really stating, you know, I was working very hard and I saw you over there laughing and joking with other teammates, and make sure that you're giving specific examples in these situations. Also state the fact. So, you know, I'm working very hard. I feel like I'm not performing to my best ability, and I feel like I would really like to have you put a little bit more effort in and help me out, and so we can all work together. So really asking what you need. I need your help. I want to work together. I want to do this together. I want to produce the best type of care that we're all here for, and reconfirm that. We are here together. I know we're all here together to provide this care for the patients, and do the best that we can. So making sure that you're reinforcing that and telling them, I came to you directly because we are friends. I want to make sure that you know that I care about you and our relationship is important, but I wanted to confront you personally and tell you how I'm feeling, so you don't feel like I'm going behind your back about anything. So I think that's really important in these situations, making sure you guys can relate to each other, making sure that it's not an attacking type demeanor when you're having these conversations, and really try to relate to each other is one way that you're really going to have positive outcomes. And try to relate if they come back and say, well, I felt like this. Really try to see where they're coming from, see what kind of shoes they're in, and try to build those relationships so you guys can come to a conclusion and make sure that the work is being done and the care is being provided at the top quality that everyone would want to do.
All right, so that brings us to our next scenario titled Unavailable Prescription. So this is a scenario that a lot of us have found ourselves in the past, so I think is very applicable to our topic today. The scenario is that the pharmacy receives a new prescription for a brand name medication that is not regularly stocked. As a result, the medication will need to be purchased and the patient will not be able to get the medication until tomorrow's inventory order arrives. The technician who processed the prescription left a message for the provider to inform them of the delay. You now receive a return call from the provider who is not happy and even a little angry and wants to know why the prescription cannot be filled. So, Joe, how would you personally handle this particular situation?
Well, I know I've been involved in this situation as a technician and intern multiple times. I believe the first step that is most important is to demonstrate that self-awareness. If you are already having a stressful environment or you're just not having a good day, it can be easy to not demonstrate effective communication between yourself and the provider. So being aware of your current state, just making sure you're making rational decisions. You also, it's important to display empathy with the provider. You have to have an open communication with them. We are all trying to treat the patient. We all want what's best for the patient. It's not that we are trying to block the patient from getting a drug. We just are having delays with it. So we really have to be open with the provider, kind of ask them, is there anything we can do to help with this? Maybe we can call around to other pharmacies to see that it's available, or just see what we can do to expedite it. Worst case, the patient might just have to wait till tomorrow to get the medication. It's also really important to just put yourself in that provider's shoes. They could have a very heavy patient volume for the day, and maybe they're short a PA or a nurse. So, I mean, they might already be having a stressful day, and this could just put them over the edge. So really just having open communication, just kind of describing common goals of getting the patient their medication, and just having an open discussion is really important in this situation. For our next scenario, you are an inpatient pharmacy IV technician at a children's hospital working a regular weekday shift. A label prints out for a routine infusion of canakinumab for one of the pediatric patients that is due at 3 p.m. the following day. You and your coworker mistakenly read this as due today and send it through to the IV preparation room for staff to compound the medication. After the medication is compounded, you read the label and realize that it's not due until the following day. The medication costs $20,000, has an expiration date of 3 hours, and the patient is not coming to the hospital until tomorrow. Eric, how would you handle this situation?
Yeah, Joe, I think this one can be a tough one. It's as you said, it's a very expensive medication and something that doesn't sound like the patient's going to be able to receive the medication. I think the very first step that we could take is really avoiding the blame game of kind of a he said, she said scenario of who ultimately made the error. I think when you're working on a team, avoiding that blame game can go a very long way. And then you can take ownership when appropriate. So if it was something that you can take ownership of, if it's appropriate, I think that goes a long way as well. In this particular situation, is actually one that I found myself in a couple of years back. The big thing was to determine what the next steps were of how to prevent it in the future. So when a problem of this magnitude comes up, the discussion was all around avoiding that blame game and then deciding what next steps can we take to prevent this in the future in a very respectful way. So there's good open dialogue about what next steps we could take to prevent it and very open communication between the team. So I think taking all those concepts together can be a very effective way to deal with a scenario like this.
All right, our next scenario is wrong patient's medication. Mr. Schmidt has arrived at the pickup counter and you go to obtain his prescriptions, which was filled less than an hour ago. You return to the counter and open the prescription bag, only to find that Mr. Smith's prescription is in the bag. You recall that both Mr. Schmidt and Mr. Smith's prescriptions were filled in the last hour, and the pharmacist must have placed them in the wrong bags. You need to bring the error to the pharmacist's attention and make a plan to contact Mr. Smith. Kelsey, how would you handle this situation?
So I think there's a couple of important things that we have to think about with this type of situation. The first goes back to John and Sarah's points about self-awareness before we respond. We need to ensure that we, respond in a calm and collected manner. We have a patient standing at the counter whose medications are not filled, so we need to explain ourselves and that we need a few moments to get his prescription together and apologize for an additional wait time and excuse ourselves from that counter. Secondary thing is we need to approach our pharmacist. Again, back to the presentation, best to do this, just ask for a quick private conversation. There's not really a immediate need to get the entire store involved in the situation. We need to explain the situation clearly, state the facts. Both these prescriptions were filled within the last hour. They probably just easily got mixed up, and here's what happened, and now we're in a situation that we need to correct. So in these types of situations, very important that we don't place blame on any member of the staff or any of our coworkers. Secondary, also be thinking about offering a solution at this time too. So immediately we know that we have a patient waiting on his prescriptions whose prescriptions are not filled. So we need to redispense and fill Mr. Schmidt's medications because he's currently in the store. And then second, we need to also contact Mr. Smith because he has the wrong prescriptions at home. So in doing that, I personally would focus on filling Mr. Schmidt's medications. When you go back to the counter with the correct prescriptions, obviously apologize again for the additional wait time and explain that there was an issue with the medications and that you and the pharmacist had to work together to correct it. And then always thank the customer for their patience and understanding in that sort of situation. And then in regards to contacting Mr. Smith, it's very important to clearly explain that there was a mix-up that occurred, that he received the wrong medications. That way we're preventing him from potentially taking the incorrect prescriptions. Tell him that you have his correct medications ready for pickup at the store, and then additionally apologize for the inconvenience and the mix-up, and thank him for understanding as well. So I think those are the most important things here, is just being self-aware about how we're going to react to the situation in the moment, be clear and concise in bringing it to the attention of who needs to be involved, and then do what you can to rectify the situation.
For a final scenario, we have a prescription that is not ready by the time promised to the patient. Mr. Williams, a recurring patient that has a reputation as a grump, calls your pharmacy to request a refill. Based on your slow morning, you politely tell Mr. Williams that his prescription should be ready in the next hour and hang up. Over the next hour, your workload picks up dramatically. One technician goes home sick, and numerous patients are waiting for their prescriptions to be filled. Mr. Williams arrives, and one of the less experienced technicians informs him that his prescription is not ready yet. You need to step up and resolve the situation. Ryan, how would you handle this situation?
Well, Connor, this scenario is probably as old as community pharmacy itself. The scenario is similar to the one where you're talking to the provider because in a way the conversation is being forced upon you. You don't have much time to step back and think about how you want to respond to the patient. I remember being in this situation even outside of pharmacy, working at a big box retailer where a customer came up to me out of nowhere and was upset that something wasn't to their liking. I'll always remember in that moment feeling that flight or fight response that John talked about, because you're immediately put on the defensive, right? This can be a big challenge to practice self-regulation. You're already stressed out by how busy the pharmacy became, and it's extremely important to de-escalate the situation by calmly speaking with the patient. There are a couple of things I would want to make sure to do in this scenario. One of them is to show empathy to the patient, really showing the patient that you care and that you understand that this wasn't what they were expecting. After all, in this scenario, I did give them a time that the prescription would be ready by. In this case, stepping up, using facts that the pharmacy became extremely busy and you're working as hard as you can to provide the best patient care to everyone that comes into your pharmacy. I would tell the patient in the future I would do my best to provide better estimations on how long it would take for the prescription to be ready, allowing for the chance that the pharmacy does become extremely busy even on a light workload day. In this scenario, it can be easy to play the blame game like John mentioned. For example, if I was the other technician in this scenario, it would be easy to say, someone else promised it at that time. They shouldn't have done that. It's their fault. Or there's nothing that I can do about it. I'm already working as hard as I can. Someone else is going to have to help this patient. As we're all part of the same team, it's really important to apologize to the patient, show empathy, and make sure that you let them know how you're going to fix the situation. In this case, letting the patient know where their prescription is at in the filling process and prepping the prescription as soon as you can. Well, we really hope that this exercise was helpful for you to practice applying what John and Sarah talked about, and thank you for participating. There will be a couple of assessment questions at the end, and our contact information is here. Connor, did you have any closing thoughts?
No, we just want to thank you all for joining us today for this session. We really hope that you find the strategies presented here today to be as valuable as we do, and we hope that you're able to utilize them to navigate your own challenging situations in the future. Additionally, I wanted to thank all of the contributors to this presentation, both the residents and PSW for coordinating, and especially want to thank our content experts for taking time out of their busy days to make this content possible. So thank you to John and Sarah. If you have any further questions, please feel free to reach out to any of us. Thank you.